Hello, everybody. My name is Dr. Emery Pitcel, Rothrock Chiropractic and Rehabilitation, joined today kindly by the magnificent Dr. Maggie Sopic of Recenter Chiro over in Boalsburg. Now, last month we kind of went through a little bit of a McKenzie progression where Dr. Maggie and I showed how you can do lateral shear overpressures on yourself, and then we showed how we can actually add that overpressure on the table. Now, with a lot of jaws, we actually find we could typically get away with just a doctor overpressure or the patient working on it themselves. But every once in a while, we got the patient that just really wants fire thrown at it, or we figure out that, like, hey, this is actually a pretty stubborn TMJ, and we can justify adding force progression onto it. So Dr. Maggie very kindly volunteered to be a demo today on how we can adjust the jaw. So we wanted to show that to you all today. So the big thing with the TMJ is first we identify what way does it really need to shear into to kind of actually get that improved of functionality and decrease of pain and neurological reset. So for the sake of the first one, I'm going to show it as if it is a shear to the left, so contact from right to left. Do you want me to actually do both sides so that way you don't walk out of here feeling like
Sure.
like
Yeah.
crooked in your jaw?
Whatever.
Plus, then it would give everybody
Yeah.
two times to kind of see a whack at
Yeah.
it, right? So what we do is it's kind of like actually setting up a regular old neck adjustment. But for our typical neck adjustments, what we do is we make a contact on the side, the articular pillar of the neck. But this time we actually move our contact onto the jaw. Now this is still going to move the neck, which we don't have to apologize for. A lot of times if we're working somebody for TMJ, they're going to need a little bit of neck management along with the jaw management because it's kind of all connected and functionally tied together. You agree with that, Doc?
Yep.
Awesome. But to get the jaw moving a little bit more, what I like to do is we kind of set it up like we're going to do a neck adjustment, move the contact onto the jaw. And I like you to actually open up your jaw maybe about a quarter to halfway. There should maybe be about a finger width like that should be able to fit between your teeth, right? And so she'll open up her jaw. We try to keep it relaxed. And then from here, we make the contact. Are you ready?
Mhm.
Okay. And we just kind of go like that. How'd that feel, Doc?
Oh, that felt amazing.
Okay. Now, most of the pops, if it did hear it on video, most of the pops admittedly were coming from the cervical. Usually the TMJ itself isn't going to make a loud pop. But as we always say in practice, you probably say something similar, correct? The popping doesn't matter as much.
Right.
It's the functional movement that then makes you feel better, be less tight, and to improve your functionality, right? And just for a good demo on this side, again, the contact, here's kind of like that corner of the mandible. We go just a little bit forward from on there. Dr. Maggie's going to open up her jaw for about, finger width in between. And we make the contact here and push down and away on that. How did everything go with that?
Great.
All right.
Yeah.
So for a demo, that is how we would actually adjust a jaw if and when indicated. So hopefully that was valuable for you all to see. If you believe you could benefit from this or know somebody in the State College, Center County area that needs help with their jaw, we'd be happy to help. We'd be happy to see if this is something that should be integrated into your care. But from myself and from Dr. Maggie, we want to thank you both for watching the video and take care until next time, everybody.